Welcome back, Scissors and Scrubs. I'm Nicole.
I'm Laura.
And here we are on a chilly February morning.
Very chilly.
Unfortunately, I have a wake this evening, so we could not do an evening recording. Got a lot of feedback on the Ozempic episode.
I think a lot of people are into the Ozempic.
And a lot did not like it being...
not talked about well.
Not talked about in a good light.
Yeah.
I mean, I'm glad it works for people.
You just have to think like long term. You have to change your ways. It's not an easy out.
Yeah. And then the debt conversation has been more of a work thing. My husband thinks, oh, I'm so excited you're actually worried about... Okay, so the debt thing was a big thing.
Yeah.
And, but that's more of like, it's been going around back and forth talking at work and stuff. And
yeah.
I'm kind of shocked at what some of the debt that the kids have.
It's unreal.
It's unreal. The school debt and stuff, which of course makes me start thinking of Vanna's debt, like for college. I'm trying to mitigate it, and I don't know. You know what? Go in the military. They'll pay for your college.
I just
call it a day.
Sam was actually saying like he was thinking about doing the community college to UMass. Mm-hmm. You pay nothing.
I would love to see her do that. I don't think there's any way in how I'm going to convince her to do that because they want that college experience. And I don't think you should pay thousands for it.
Thousands. Hundreds of thousands.
I didn't go to college. I mean, I went to college, but I was a commuter and I was older. I parties with my friends at their colleges.
I don't think your life is any...
I don't think it's any different if you miss
off.
Not living in a dorm and getting shit-faced your first senior year and, God knows what you're doing.
And you can do that when you go visit your friends.
Like. I 1,000% agree with you. I would rather come out of college with little to no debt than to go say I lived at USC and I went to the football games, but now I'm $100,000 in debt for it. Right. I'm not a big fan of that.
Yeah, but whatever.
So now here we are. We're looking at Love Month. It's Valentine's Day. Roses are coming out in pink and people are going to get engaged and we're going to have big romantic.
Do people do that?
Oh my God. When I remember the first Valentine's Day Brian and I spent together, of course, amateur night, we go out on Valentine's Day, went to the Chat House in Boston.
Oh,
like
nice.
a couple next to us he proposes at the table. I'm like, I looked at him. I said, if we ever get married, don't you dare ever propose to me.
Ever do
on Christmas, my birthday, don't
No,
you
it doesn't
dare.
count. It doesn't count.
I don't want it.
Well, it's not your gift. Like, I don't like when people do that, like, on your birthday. I'm like, no, this is my birthday.
I want a random day with nobody around.
That's what I mean. Like, I want it to just be,
But I don't need a big production.
No.
It's not my thing.
No.
It's not my thing.
But we're not very romantic.
No, but for those who are romantic and have had that nice night and the sheets have the rose petals on it, Laura, and they've got
I would die. I would literally die.
You came home and the bathtub had all the candles and rose petals in the tub.
I'm going back out. Clean this up. This is a mess.
You know what, Laura? My husband, I love you, Brian, is so unromantic. I shouldn't say that because I got violently ill over the weekend. I'm going to TMI with all my podcasters, but you're vomiting and, there's a little pressure when you vomit. And maybe, I maybe shit myself while I was vomiting. And this is what love is calling your husband out of bed. Can you get me some clean clothes? And he just gets up and he does it. That really is what love is? Or when you vomited on yourself and they help you. That's what love is. Yeah. Okay. It's really not the bathtub with the flowers, but I wouldn't mind a candle once maybe, or I don't know, a surprise. He's just not a romantic man. Okay, he's a thoughtful man.
Yeah.
He loves me to the ends of the earth, but romance, not his top process.
Mike would probably be romantic if I would
let him.
Let him.
Your reaction to just the rose petals in the bed was pretty sure kibosh on that.
Doing it.
I want you to go over the fucking top, dude. Candles everywhere, all right? I want to trail from the back door over Pluto because he's not moving, up the stairs of rose petals, down the hallway into the bedroom.
I wouldn't even walk in the house, probably.
It's the best. Well, this is leading somewhere, I swear. Yeah. For those people who do like that, Laura.
There are people that
and they have affectionate, things start going, boom, boom, boom. Deeds are done on Valentine's Day. Well, 9 months later, we're going to have some births.
We do have some births.
So we decided to cover today vaginal births, C-sections, ectopic pregnancies, and other natural remedies for pregnancy.
Those are gross. I'm not happy that you looked into that.
Okay, so what do you want to do? You want to go first?
Sure, I'll go first.
I mean, I'm going to wind up dominating half the conversation. Yeah. No, not really, because I'm reading from papers.
Yeah.
All right, so go ahead.
All right,
ectopic pregnancies.
Ectopic pregnancies. I got this information from mayoclinic.org. So all pregnancies begin with a fertilized egg, as we should all know. Usually this fertilized egg attaches to the lining of the uterus. An ectopic pregnancy occurs when a fertilized egg implants and grows outside of the main uterus cavity.
And egg fertilization, I think, happens in the tubes, correct? Yes. So sometimes, it doesn't progress out of the tube.
Yeah. They most often occur in the fallopian tube, which carries eggs to the uterus. These are usually called tubal pregnancies, but sometimes ectopic pregnancies occur in the ovary, the abdominal cavity, or the cervix.
The abdominal cavity would be so bizarre.
Yeah, a
Like
lot of
outside
times
of
it's
the
like the
uterus.
C-section scar or something.
Yeah.
The rates of occurrence, it usually occurs in older women, in a person that's had multiple pregnancies, in non-white women. They have
Interesting.
higher rates of ectopic pregnancy.
Is PID a complication too?
Yeah, I'll get into
All
that.
right, I'm sorry, I didn't know.
No, that's all
Just
right.
skipping
That's who it most often occurs in. Obviously, it can happen to anybody.
Right.
An ectopic cannot survive. An ectopic pregnancy
Period.
cannot survive, period. If it is not attached to the uterus
Placenta,
lining,
yeah.
it cannot feed the placenta. It cannot survive. And the growing tissue can cause life-threatening bleeding. Yeah. It accounts for 40 deaths per year in the U.S., an ectopic pregnancy.
Wow.
Yeah.
I didn't know that.
Symptoms of an ectopic, early symptoms, you're usually going to have your early signs and symptoms of pregnancy. You might be nauseous, might not feel great, whatever normal signs and symptoms of an early pregnancy early on are. And you're going to have a positive pregnancy test because you are pregnant.
Creating the home, yeah.
As the fertilized egg grows, the signs and symptoms become more noticeable. They become different than pregnancy symptoms. You're going to have light vaginal bleeding and pelvic pain. You can have shoulder pain. They said that happens. I think the shoulder pain is when the tube starts to bleed. You get shoulder pain. And
Well, the shoulder pain also happens like in scopes and stuff. When any of the abdomens get pressure.
it's the way the pressure,
it refers
where
to
the
your
pressure
shoulder.
is.
It's weird.
And you might have an urge to have a bowel movement. Specific symptoms depend on where the ectopic is and what nerves are affected by blood or pressure or whatever. Emergency symptoms of an ectopic are like if your fallopian tube ruptures because of this pregnancy in your tube.
Imagine how painful that would be.
No, you're going to have extreme lightheadedness, you can faint, and you're going to have signs and symptoms of shock because you are bleeding.
You're bleeding out. And some of them come in and they are like hemorrhaging.
Oh, yeah.
They're like, it's rough.
Seek medical treatment for any of the signs and symptoms of an ectopic, including severe abdominal pain and vaginal bleeding, extreme lightheadedness or fainting, shoulder pain. And like I said, because you're getting that because your fallopian tube is ruptured. The causes of tubal pregnancies are usually from an egg getting stuck because of a damaged, misshapen, or inflamed fallopian
All right,
tube.
there it is, yeah.
Hormone imbalances or abnormal development of the egg can also be a cause of an ectopic. Risk factors are previous ectopics. If you have had an ectopic, you are at a higher risk for having another ectopic. Inflammation or infection, STIs. If you have a chlamydia or gonorrhea, especially, they cause pelvic inflammatory disease,
what I heard.
and your tubes can get inflamed, and that pregnancy can get stuck in the tube. Fertility treatments are risk factors. IVF or similar treatments make it more likely to have an ectopic. Tubal surgery. If you had previous tubal surgery to correct a closed tube or a damaged tube, now you've had surgery on that tube,
Right,
so it's
so
going to
scar
have
tissue and
scar
stuff,
tissue and
yeah.
everything. So it's more likely that a fertilized egg can get stuck. And it's people like, well, it got up there to get fertilized, but now it's a fertilized egg, so it's a bigger egg and it's growing, so it can't get back
Sperm's
out.
a lot smaller than the egg.
Your choice of birth control can be a risk factor. An IUD in place makes it more likely for you to have an ectopic pregnancy if you get pregnant with an IUD. It's very rare to get pregnant with an IUD.
Right, because it's supposed to make like you're already pregnant.
Right, but some people do, it's like 99.9 don't, but then you could have that 0.1, but it's more likely that you will have an ectopic pregnancy if you get pregnant with an IUD. It is also more likely for you to have an ectopic if you had a tubal ligation. Because sometimes it's not a complete ligation. You can still get pregnant, but now that egg is going to be stuck in that tube that's been partially ligated. And smoking is a risk factor. Cigarette smoking just before getting pregnant increases the risk, and the more you smoke, the greater the risk. Complications of an ectopic, they can cause the fallopian tube to rupture, just burst wide open. And without treatment, the ruptured fallopian tube can lead to life-threatening bleeding. Prevention, there is no way to prevent ectopics, but you can lower your risks by limiting the number of sexual partners and using a condom when you have sex to prevent STIs, because that will reduce
I mean,
your
if it's
risk.
Valentine's Day, you can use, flavored ones, glow-in-the-dark ones,
all
whatever you
different
want.
ones,
I mean,
yeah.
it's Valentine's Day.
Get crazy. That lowering your risk of STIs lowers your risk of pelvic inflammatory disease. Don't smoke. If you do, quit before you even try to get pregnant.
Right.
Like, don't be smoking and be, oh, look, I'm pregnant. I'll stop now. Wait, if y'all like thinking about it,
Oh, I'm crowning. I might have put that pack a day away.
just stop once you start thinking about getting pregnant. To diagnose a ectopic pregnancy, your doctor's going to do a pelvic exam that helps identify areas of pain and tenderness, or if they can feel a mass in the fallopian tube, if they can feel a mass in your ovary, if they can feel a mass elsewhere. But they won't diagnose you just based off the pelvic exam. They're going to then say, okay, this feels funny in your fallopian tube. Let's do a pregnancy test. The doctor will order the HCG blood test to confirm, yeah, you're pregnant. That's what this is. And that may be repeated every few days until an ultrasound can confirm where that pregnancy is. Because it might say you're pregnant, but you can't see it anyway yet because it's in the early stages. And usually you can see the pregnancy 5 to 6 weeks after conception. So you might be taking that test every few days for 5 to 6 weeks until they can say, yeah, we see the pregnancy and it's in the tube. They're going to do ultrasounds. They can do a transvaginal ultrasound, which allows the doctor to see the location of the pregnancy, because they can see the cervix, the uterus, the fallopian tubes, and the ovaries using a vaginal ultrasound. And that is a big wand.
Up your hoo-ha.
Up your hoo-ha. And then they can also do an abdominal ultrasound to confirm the pregnancy or look for internal bleeding.
Yeah.
So the transvaginal ultrasound will more be like, yeah, I can see the pregnancy in your tube. And the abdominal ultrasound's more like looking for blood or just confirming that you are pregnant. They'll do other blood tests. You're going to get a CBC, which is a complete blood count, to check for signs of bleeding, anemia, anything like that. And they might also do a type and cross match for your blood type in case you need a transfusion if you do show signs of blood loss. How they treat ectopics depends on when they find the ectopic. Again, an ectopic is non-viable and needs to be removed.
Be interesting if someday they could transplant it.
I'm sure they're working on that, because
I just
they
don't know
can
how
put in a fertilized
like how
egg.
damaged is the fetus though at that point?
Right,
I don't
like
know.
it's been stuck there. I don't know, but right now, ectopic pregnancies are non-viable because you need that lining of the uterus to feed it, and they have to be removed to prevent life-threatening complications. If an ectopic is found very, very early without unstable bleeding, like if they say, oh yeah, there's a pregnancy in a tube, but there's no rupture, there's no other problems, they can treat it with methotrexate, which stops cell growth and dissolves the existing cells. It's an injection that you're going to get from your doctor. After the injection, you will have repeat HCG tests to check your hormones, to make sure that the shot has worked, that it's not growing anymore, and to see if you need another injection or not. There are 2 surgeries that can be done to remove ectopics if it's further along and you can't use the methotrexate. One is a salpingostomy and one is a salpingectomy. Both can be done laparoscopically. Salpingostomy is when the ectopic is removed from the fallopian tube and the tube is left in the body. So they just make an incision,
repair it.
take the egg out, repair the fallopian tube, and you still have your tube. Salpingectomy is when the tube and the ectopic are both removed. A lot of times when we see them, we just do the salpingectomy.
This is usually when emergent when it comes in. These women are bleeding. It's an emergent case.
It's already
they come
burst.
Up right out.
It's ruined. It's
blown the tube.
And we just take the tube and the ectopic pregnancy out. Which surgery that gets performed depends on the amount of bleeding and damage to the tube. Also, if you don't have another fallopian tube, if you've already
gonna
had
try to
damage,
save
they're
it.
going to try as much as they can to keep that tube in there. Even if they're like, it's pretty far gone, they're going to try to save your tube just so you have
An option.
hopefully one that works.
They're really sad sometimes because it's somebody who's been trying.
I
and
know.
they
They've had
want,
IVF.
you know,
This is like and then you get this and you have to take their tube and it's
right. It's
sad.
brutal.
If your tube has ruptured, your surgery will be emergent because you are bleeding now. And usually the tube cannot be saved if it's that far.
Right.
An ectopic pregnancy is a pregnancy, and when it is lost, it's devastating to people. You should seek out help, support, counseling, whatever you need. It is a loss of a pregnancy. And women who have ectopics can go on to have healthy pregnancies in the future. And if both of your tubes are removed or damaged, if you're like, that was my last one and I blew it, IVF can still be performed. They can still take eggs out of your ovaries.
and put it in your uterus.
And then put it in your uterus. You can have a pregnancy without your tubes, but it is obviously a very sad and devastating
Loss of
thing.
any pregnancy for somebody can be brutal.
That's ectopics.
Well, let's say that fertilized egg makes its all way into the uterus and it implants and it creates a placenta and it grows and it grows and it grows for 9 months. And now comes the time it has to come out of the human body, as we like to say.
Best time. So much fun.
We're going to talk the old-fashioned way first, the old vaginal way, which, I was lucky to have 3 this way. It was such a good time. Now, I want to preface all of my information with, this is a fun podcast, nursing podcast. I'm not an A&P class. I'm not going in depth to vaginal deliveries and C-sections. This is a brief overview.
Yes.
Okay, just so you have a kind of an idea. You want to go in depth, go to Lamar's class. Okay? All right. So, vaginal birth is the most common way to deliver a baby. About 70% of babies are delivered vaginally in the United States.
I'm surprised by that.
I know.
Yeah.
I know. During a vaginal delivery is when your cervix is going to thin, it's going to open up, and your uterus contracts to push the baby out of your vagina. It sounds sweet, doesn't it?
It does.
Yeah, it's a fucking process. That, my loves,
very
is a process. Long, painful fucking process. Yep. When you start to feel your contractions coming at regular intervals, you're considered in labor. When the cervix thins and opens, it's dilation and defacement. So you go from a 0, which is a pinhole, to a 10, which is the size of a baby's head. Yeah. Can you only imagine for 1 second how that's going to feel when you're going through it? Okay.
I can.
Yeah, it's a good time. It's a good time. Yeah. Wish I could do it all over again 3 times. All right. So birth happens over 3 stages. Stage 1 is the first stage of labor begins when you start having your contractions. Some people will have contractions and then they stop. Your water breaks, if your water breaks, this isn't covered in here. If your water breaks, you got to go right in because within 24 hours, you can start getting fevers. The baby can get ill. So whether you're having contractions or not, your water breaks, you go in and you go get yourself checked.
Yeah.
So the first stage of labor is going to begin when you have the contractions. It's called progressive changes. And it's causing progressive changes in your cervix. And it ends when you are fully dilated. For first-time moms, the first stage of labor can last from 12 to 19 hours. Or 24, depending on who you are, like me.
Mine lasted forever.
Oh, but it was like, it can be days, all right? Stage 2. That begins when you are fully dilated, and it ends with the birth of your little tiny baby, or your 10-pounder, whatever you decide to have. It's called the pushing stage. Now, I had no clue what pushing meant until I pushed for 3 hours.
I can't even fathom that.
This is fucking something.
My second stage, maybe 20 minutes with each one.
3 fucking hours with Cameron. I had oxygen in one hand. I had the med student yelling at him and Brian, pulling my legs up because I'm on an epidural and let's go. It was, you want to see a mirror? No, I don't want a fucking mirror. I want them out of my body.
Do you want the mirror? No, I don't
so
have it.
For me, it was a lot longer than a few hours. Yep. But they usually say, they told me at the time, of course, my kid's 20, so things may have changed. But 3 hours was about the max they were going to let you push before you needed a C-section. And they were just about to C-section when he decided, all right, gave up the ghost.
No, it's like 10 pushes with one and 12 with the other.
Well, knowing him as an adult, I'm not shocked that that's exactly how it went. You have to push the shit out of him before he finally does what he has to do. All right. And then stage 3 is the part right after the birth when your baby, with the end of your baby and your placenta comes out. And that lasts for like 20 minutes or less. Now, for me, new-to mom. Forgot all about the placenta. Not thinking about the placenta. Baby's out. And in my head, I thought he pulls the placenta out with him. No.
Oh, no.
So they're doing shit, and I'm like, why am I burning? It's happening again. It's happening. Oh, no, because now I'm birthing the placenta. I'm like, oh, this isn't a good time. This is not a good time.
I didn't feel that at all either time.
For those of us who don't like pain, there are options for pain when you have a baby. One of them is an epidural. I wanted it at conception, but they told me I had to wait till I was in labor. An epidural, it delivers continuous pain meds through a thin tube inserted into your lower back. Blocks pain in the lower part of your body while allowing you to remain fully conscious. So they're going to tell you at a certain stage you're not to get you can't get an epidural anymore. And I actually asked one of the anesthesiologists, is this true? He's like, what happens is when they're that close, they can't sit still for the epidural. So when I had Garrett, I thought they had to be close together, the contractions. No, it was the intensity of them. So I was having extremely intense contractions at home every 20 minutes, but I was like, well, they're supposed to be 2 minutes apart. I was going to birth the kid in the kitchen. So by the time I came in, I was 8 centimeters. And they were like, do you think you can sit still for an epidural? I'm like, honey, I won't move a fucking muscle. No matter how much pain I got it. And I sat there and I was like, laser focused. And I'm clutching him because I'm getting contractions and they were painful. And I was like, nope. I didn't move a fucking muscle. Yeah. And as soon as that medicine went in, I was like a whole new woman. It was like the clouds opened up, the doves came out. It's like, oh, I can think again. So you can have an epidural, or you can have a spinal block.
Yes.
A spinal block's an injection that gives rapid relief to the lower part of your body, but it's only a few hours. It's kind of like a one-time deal, whereas an epidural they can continually dose. So you can get a lot of times they'll
do the spinal with a C-section.
Right. Yeah. And you can get a spinal or an epidural block, which offers rapid pain relief from the spinal and then the continuous relief of an epidural. This might be if you need immediate relief, so you can sit still for your epidural. They can give you systemic painkillers. They don't like to do that because it can affect the baby. So I will often refer to a vaginal birth as a natural childbirth, but that's not. A natural childbirth is you decide you're going to birth this baby with nothing. I don't know nothing about birthing no babies. I'm just going to dig a hole in the backyard, squat, and this shit's coming out. I don't know why you would voluntarily, I'm going to get a lot of enemies for this, I don't know why you would voluntarily not choose medication. That's me. Because I wouldn't have my appendix out without medication. I wouldn't have my tonsils out without medication.
I know, it's a whole
sure as hell not
movement thing.
But I'm not that person.
To experience, I'm like, I don't need to
experience pain.
I experienced both of them. Like I was there. I
don't understand it. Like it was like a flamethrower on my crotch. Why would I want that for hours?
I didn't have that with Jack because the only place the epidural worked was my
vagina.
Crotch. My stomach, I could feel every contraction, like all of that. I could still
feel the contractions and everything.
No, I mean like just as sharp as it was before. I just couldn't feel my legs on my vagina, which was, I was like, whatever. So I didn't feel any of that with him. And then with Sam, it fell out before I had him, but it helped with the contractions. But down below, I could feel everything. Oh, no. And I was like, what is this?
Yeah, this isn't supposed to happen.
Burning. And they're like, oh, the ring of fire. I'm like, the what? And they're like, the ring of fire. I'm like, I didn't have this. And they're like, no, that's so you don't push through that. I'm like, oh, that's why I ripped with Jack, because I just pushed through because I didn't feel anything.
I ripped with Cameron
but I didn't feel a thing. So I was like, yeah, just push. And like with just Sam, I had that. And they're like, when you feel that, don't push. And I was like, oh, okay. Oh, I get that. This is actually helpful. So I do get, like, it is helpful to feel some of the stuff, but
I'll take the tearing. Thank you very much.
I
did not like that feeling. And I remember that after Cameron, I still had the epidural and they had pulled it. And, and they're like, you need painkillers? I'm good. By the time I made it to my room, I was like, I'll take crack, heroin, whatever you got. It's on fire. I need something. It was bad. It's bad. So a natural birth is often referred to an unmedicated approach to labor and birth, Laura. It may suit you. If you want to remain in control of your body as much as possible and have minimal routine interventions such as continuous electronic monitoring. All right, they're going to monitor that baby, whether you're giving it natural, epidural, or anything, because, so I don't know what, I don't know what they're
I think at home they won't monitor.
Yeah, but why wouldn't you want your child monitored? That's home births are dangerous.
I don't know. I know I've told with Jack, I went in and I was having like literally every 3 minutes, but nothing was happening. Like no changes or anything. And they were like, oh, I'm like, you're going to send me home. And then they checked him and they were like, oh no, you're going into bed and you're not moving.
This is what I'm talking about.
His heart rate would go so low. They kept flying in. They
had
a little thing in his head.
Something's wrong.
He was so bad. And they were like, we might run you out of here emergently because his heart rate is so low. And I'm like, okay.
I'm such a nut. that I had been going to a GYN I liked, but he delivers at a small hospital. And I was like, nope, I want to go to the hospital where the baby's going to go if something happens. That's like, so I moved myself to a big facility.
That's my thought, too.
Because I wanted to make sure there was a NICU. Because I didn't want to be separated from the child.
God, why are you doing it in Boston? Then people have to go into Boston to visit you. And I'm like,
Don't visit
A,
me.
we live 5 miles from Boston. It's not far. And I'm like, and B, because if something happens to that kid, I don't give a shit if you can't visit me. I give a shit that he's in a place where they can take care of him.
Right. I don't want to worry he's getting med flighted in or whatever.
I don't want him on a
No.
fucking helicopter, me at the
So
hospital.
I'm a nut that way, which is why I can never wrap my head around, I'm going to do this in my bedroom at home. It's possible to have an unmedicated birth in a traditional hospital setting, but some women prefer an alternative setting such as a birthing center. To make home birth as safe as possible, sorry, I got to switch my page. Of course it cut out. So I'm not a big fan. I had a friend who gave birth in a bathtub. I'm going to get into those later. Not my thing. No. I don't want to be sitting in afterbirth.
That is my number one thought. I'm like, that's great that they're comfortable coming out. And I'm like, I'm sitting in my shit.
I don't want to be sitting in my afterbirth. It's disgusting.
And like all that shit that
is
flies
now
out of you. Do you ever, I mean, you've seen a birth. Like it's whoosh, like a like no
flies on.
It's a lot of shit coming out of there.
Yep, a lot of fluid. There's a lot of fluid in there. I
fluid.
mean, if from our point of view, when you see the drapes that they use to get ready for all the fluid that's coming out, I don't want to then be sitting in it. It's disgusting.
No,
okay,
I don't want to sit in any of my. I
It's-
don't even like a bath. Just a bath.
Yeah, it's not for me.
No.
If you're having problems progressing with labor, they're going to induce contractions. They give you Pitocin. They give you stuff to get you going, and you need to do that to get it growing. I'm not getting into VBACs right now. Okay, so you're having that baby, and like Laura said, maybe some of us had an epidural, and you don't have that ring of fire.
I did not have it the first time.
That
Sure had it the second.
The baby's going to tear his way out.
Yeah, he is.
So vaginal tears happen during childbirth. They're also called perineal lacerations. It's a tear in the tissue, skin and muscle around your vagina and perineum. Mm-hmm. The perineum, also known as the taint, because the taint pussy, taint ass, is the piece of material between your vagina and your bumhole.
It's not a very thick pig area.
It's a weird area.
Yeah.
And the men, they sometimes used to go in there to get the prostate that way. Do you remember that?
Yeah.
No.
Oh my God, remember that?
Yeah, it was a long time ago, but they used to go in and get the prostate through the taint. Yeah. So the perineum, as I explained, is that space, and the tear happens so that the baby's head, which could be a 10-pounder, is going to get through. But it is very common for you to tear. Up to 90% of people who give birth will have some tear during the vaginal delivery. There are 4 types of perineal tears.
There are.
I remember this scarring me in nursing school. Okay, so the first degree is the least severe. Injuries, it involves just one layer of skin around your vagina and perineal area, and it usually doesn't require stitches. Mm-hmm. Second degree tear. It's the second level of tearing is the most common. The tear is slightly bigger. It extends deeper through your skin into the underlying muscles of your vagina and perineum, and the tear requires stitches. Mm-hmm. Third degree tear. I must have had a second because I don't think my butthole was hurt. A third degree tear extends from your vagina to your anus. This type of tear involves injury to the skin and muscle of your perineal area, as well as damage to your anal sphincter muscles. These muscles control how you poop. Mm-hmm. And you need stitches with a third degree tear. Mm-hmm. Fourth degree, least common. This is the least common type of tear during childbirth, extending from your vagina through your perineum and through your anal sphincter into your rectum. Mm-hmm. It is the most severe type, and you might have to go to the OR.
Oh, yeah, if you're tearing your rectum.
Yes.
And you're tearing your sphincter, which you need to fix that.
Sphincter. So these women can have issues post.
Yeah, wicked bad.
With retention and, fecal retention.
Yeah.
Or incontinence, I should say. So I'm pretty sure I had a second degree, and I was in the stirrups for 45 minutes after he was born while they were stitching me up. And there's my husband snapping pictures. So I'm holding the baby, but he didn't think to get the surgeon's head out of my vagina out of the picture because my legs are up, his head's right there, and then me holding the baby. I'm like, Brian, I couldn't show the pictures to anybody. Like, I can't pass these around. No. Like, are you out of your mind? God bless him. Okay.
There was no pictures happening in my delivery room.
Well, it's your firstborn. We were taking pics.
No.
All right. You know what's sad is number 3. I don't have one fucking picture of his birth. I was like, oh, there he is. Isn't he cute? Okay, I'm going back to bed.
I don't have pictures of either of my children's birth.
Not the actual birth, but after, like, them in the little bassinet, the bath, this and that. So he was taking pictures of me holding the baby after I hit, but it was 45 minutes later and I'm still in stirrups.
Yeah, we didn't do it till we got to
That was a good time.
what's it called?
I was like, how, and and as an OR nurse, I'm like, oh, Vicals, how many Vicals are we using? Like, what's going on down there? How long is this going to take?
Yeah.
All right. So factors that can increase your chances of tearing are it's your first delivery, me. Yep. The baby's face is sunny side up instead of face down. Yeah. They've used forceps or vacuum delivery. We could get into all that. I'm not getting into that, but those can be pretty traumatic.
Because they're like,
they're traumatic.
Spreading it as it is.
Yeah. You have a large baby. You have prolonged pushing. That was also part of my problem. You've had an epidural.
Yep.
I also
That's
had that.
what my problem is because I couldn't feel it, so I just pushed right through.
Yeah. So. All right, so complications of vaginal tears. They are uncomfortable and they are painful. Yes, they are. If to this day, my son is 20, when I get my period, I can feel the tear.
Now,
because
I had
the weight,
they sewed it all up and all that stuff. I never needed pain meds out. I never felt it.
I was in bad shape. Yeah. Like I said, the nurse came in. She's like, oh, you look like hamburger meat down there. Like, not a description I ever want to hear about my vagina, but thanks for sharing. Yeah. Okay.
But people do say it's, but I've never had pain.
You were also a lot younger. Well, no, I mean, you were 6 years younger than me when you had him, but I mean, it's not like you were years and years behind me, but I could feel it. I could still feel it. So, but most small vaginal tears will heal within 2 weeks. It's common to feel discomfort for a month or two if your tear was large. 3rd and 4th degree tears are more complications due to their severity. You can have infections, bleeding, painful intercourse. Once you're permitted to have intercourse, Laura, because you got to wait.
I think you're going to want to wait.
Well,
if
you'd be surprised.
Torn up.
My nursing instructor said she had one woman gave birth and had to chase the husband out of the room because he was climbing on top of her after she gave birth. She was like, I actually filed paperwork on him.
Yeah, you should because that's abuse.
It was abuse. But so they were fucking idiots out there. Fecal incontinence, leaking poop, ongoing pain and soreness. So if you have any of these, you need to go and get that checked. All right. So I'm not going to go through management of tears. That will be done if, God forbid, you ever have one. But so that is a risk when you are having a vaginal birth. Tears. C-sections. I'm almost done, guys. All right. C-section is used to deliver a baby through a surgical incision made in the abdomen and uterus. All this information came from Mayo Clinic, FYI. So C-sections, people now are like planning them ahead, even if they've never had a vaginal birth. They just, I want to do a C-section. They want to control everything.
I never understand why they want to control have surgery.
Yeah. They're going to know the sex of the baby, where it's going to college, what day it's going to be born. Like, it's ridiculous, okay? So you might need one if your labor isn't progressing normally. The baby is in distress. The baby or babies are in unusual position. A lot of people delivering twins have C-sections. You are carrying more than one baby. There is a problem with the placenta, as like it's covering the cervix, or you get placenta abrupta or whatever. Yeah. A prolapsed umbilical cord, a major problem because that can lead to cerebral palsy and things. There's a health concern for women who may have heart and brain conditions. They think that the pushing might be too stressful on the mother, or there's a blockage like a fibroid or something's blocking the canal, or there's a pelvic fracture, or the baby's got this massive gigantic melon and they know it's not going to come through the vag. Or you've had previous other C-sections, so you can do a VBAC, which is you can have a C-section and then try a vaginal birth, but you really can risk rupturing the uterus doing that. It's not something I would recommend. People have done it. People have done it successfully, but it would scare me. Some women will request C-sections for their first baby. They want to avoid labor or the possible complications of a vaginal birth. Bullshit stuff to do. Or they may want to plan the time of delivery. Babies come when babies come. Yeah. You can't control this shit. I'm sorry. But it's not a recommended practice to do this.
Yeah. I think that they're going away from that. That was like a huge trend. Do you remember 5-10 years? Everyone was, I'm just going to do a plan C. Why? There's nothing wrong. Why are you going to have surgery? It's a major surgery.
When the baby's ready, the baby's ready. Yeah. All right. And they'll let you know. Trust me. So the risk to babies for a C-section, they can develop breathing issues. They can tend to breathe too fast days after birth, which is called transient tachypnea. Or they can have a surgical injury. It's very rare, but sometimes a nick. I mean, we've done recently some emergency sections, and I'll tell you, they just slice and go in, and they have to because the baby's dying.
Saving the baby and the mother.
It scares the shit out of me because you don't know where that.
There's a baby right there.
Are we going to slice the face? Risks to the mother for a C-section are infection. After the C-section, you can have infection. We've seen those come in. Blood loss, reactions to anesthesia. That's with any surgery. A lot of these are with any surgery. Yeah. Blood clots, surgical injury, it can do an increase to risk of future pregnancies because C-section increases the risk of complications in later pregnancies and in other surgeries. The more C-sections, the higher the risk of placenta previa, in a condition which the placenta becomes attached to the wall of the uterus, and placenta accretia, where it actually grows in. Like the placenta is supposed to kind of shed off and come out. Accreta, it grows like a spider into the wall of the uterus and doesn't let go, and that can be a huge problem. And you can also risk tearing along the scar line, like I said.
Right, you've now weakened that.
Right.
Muscle.
They can be done at home, which I think is bizarre.
No.
Oh, your healthcare provider may ask. Oh, no, I'm sorry. Take that back. Scratch. That was wrong. This is what to do before a C-section.
It's like,
Yeah, at home. And this isn't The Crown where we're doing a lobectomy in the middle of the fucking palace. At home, your healthcare provider may ask you to shower at home with an antiseptic soap the night before the C-section. Don't shave your pubic hair within 24 hours of your C-section because that can bring infection. And if your hair needs to be removed, they're going to do it when you get in there. Some people wax consistently, but you shouldn't really touch that area and get any risk of infection before. At the hospital, you're going to be cleaned. They're going to put a tube, give you a Foley catheter in your bladder. IVs are going to be placed in, and you're going to be all prepped out, ready to go. Dad's going to be brought in, sat at the head, and they're going to begin the procedure. Most of these are done on a regional, so you can have an active participation in your child's birth. And you have to know, like, you're still birthing this baby, Miss Scarlett, when you have a C-section. To watch it done is... It's one of the most. I remember we had to do one down in the OL, like an emergent one, and the person scrubbing it hadn't scrubbed. Excellent scrub, but he hadn't scrubbed a C-section before. I'm like, okay, you need this X, Y, and Z. And he's like, okay, well, what about retraction? Like, they're gonna pull it open with their hands. And he's like, okay, but what about? No,
like, they're going to pull it open with their hands. And he's like, no, that I'm like, I'm telling you, it's the most violent surgery.
And then they're
going
to scoop in behind that and pop it out,
Yeah.
and push on her stomach till she's vomiting at the head. It's pressure.
I said, it is the most violent surgery I have ever seen.
It's rough.
And he's like, no, I'm like, I'm telling you. So then we come down, we do it, and he's like, that was literally the most violent. I'm like, I know, especially an emergency, but any of them, they're all, it's very...
But if
It's
you
a
have
lot.
a lovely old, she just needs a C-section, wasn't progressing, and you put me in that room, right until the moment that baby is delivered, I am very engaged. But it's the only surgery where if everything goes well, there is a
it's like
cute little
lovely.
fucking baby looking at you, little toes, little fingers. I'm done?
Yeah.
All I'm doing now is staring
What
at the
is it?
bassinet.
What is it over there? What's it
You don't need a silk. You go no.
Everything's on the menu. Help
Help
yourself.
yourselves, guys. It's a buffet now. Oh, look at the little baby. How much is he breathing? Oh, everything's good. Okay, because they're so fucking cute with the little squishy faces.
Oh my God.
Can't stand it.
They do that little duck.
They do, and they're crying, and then they bundle them up like the little turkey,
Oh,
and they get the
they're
little
so-
bows or whatever on
yeah.
their head. Oh, I can't stand it. I could bury myself in babies.
know.
All right, so abdominal incisions. The doctor makes his incision. We just basically told you what's going to happen, and they literally deliver the baby through that uterus. And then the poor mom is, she's holding that baby. She's
Filleted
like,
open.
whatever the fuck's going on. And then they're closing and working on that uterus. And it's amazing how quickly it goes down. It's pretty fast. So you're going to be in the hospital 2 to 3 days. They will talk about pain relief and different options you're going to need. Once the anesthesia wears off, like any surgery, they're going to want you to eat, drink, and walk. Make sure you don't get blood clots, etc. They're going to take the catheter out to make sure you pee, make sure you poop. You can start breastfeeding as soon as possible. And they'll talk about breastfeeding with you when you get there. When you go home, you have discomfort. You could be tired. To promote healing, it's the only surgery you're going to go home and they're going to expect you to go full speed ahead after having a major abdominal surgery. Right. But you really need to rest. Easier said than done when now you are taking care of a newborn.
Right.
You try to keep everything your baby needs within the reach don't lift more than 25 pounds. You do really need to try to take it easy. You shouldn't be driving.
You've had if you had your uterus removed, you wouldn't be doing that stuff when you recover. It's the same surgery.
Right. You need some time to relax and you need to, use your pain meds. If you're in pain, you take them. Wait to have sex to prevent an infection. You wait to drive because you're taking pain meds and they can affect you driving.
Yeah, and just you're going to be, even if you're not taking narcotics right after, like if you choose not, you're still in pain and you are not strong.
You
Like
just
you shouldn't be
driving.
driving.
You shouldn't be driving. Check your C-section for signs of infection. Is it red, swollen, leaking discharge? Do you have a fever? Do you have heavy bleeding? Is the pain getting worse? And then start raising your kids because teenage years are worse than anything I just described right now.
Way more painful than any of that.
Suck. So last night, I'm writing this podcast. When Laura and I going back and forth, this is what we do when we write our podcast. We go back and forth. What are you covering? I don't know. I'm covering this. Okay, I'm going to add this. I just finished this. I said, okay, well, I'm going to add a little surprise.
And I was not happy with this.
And she's like, well, what do you mean? I said, I just came across some
weird shit.
Some weird shit, and it's going to be good. She's like, well, I don't have a lot. I'm like, well, all right. She's like, you should have waited to tell me this stuff because it's
just
so
to get my pure reactions from it because it's fucking gross.
But we're going to go back and forth. Okay, now I'm sure there's somebody out there right now munching on their granola, eating their organic whatever. They're vegan. They've had their kid. Their kid was birthed at home in the tub. They sat in their afterbirth. They did all their shit. And they're going to hear this and going to say, there's absolutely nothing wrong with any of that.
And there's nothing wrong with it.
And there is not. But Laura and I are not those people.
We're city folk.
And we're judgy and we gossip. And we are fucking going to make fun of it. Okay? So you do you. And now I'm going to do me.
Let me do me.
Right? So I'm doing me with some of the shit we found. So Laura, you take it away first.
All right. I can't decide which one's the grossest.
Disgusting thing to talk about first?
Yeah. So I think I'm going to do delayed bathing first. So I got this from International Childbirth Education Association. Mm-hmm. It is now recommended, like by everybody, that you wait at least 8 hours after birth to bathe the baby. So usually, you take them out, you're still in like the little labor and delivery room and they bathe your baby. Well, at least when we had kids.
Because they're covered in blood,
vernix.
shit,
Yep.
vernix and everything else.
They're covered in like this white
cream.
So anyways, the vernix does help to reduce instability associated with cold stress. The babies get cold. You have to keep them warm. The temps are always up. They put them under a little warm as if they're cold. It does stress their bodies to be cold. Mm-hmm. It decreases hypoglycemia, the incidence of it. It decreases weight loss in infants, and it helps to decrease jaundice. Also, the skin is protected from the antibacterial and antimicrobial properties of the vernix. That's what it is there for. And early seeding, it helps the early seeding of the newborn microbiome. So like you're trying to keep all this, the stuff they get from the mother, like my microbes are on that baby, and that helps them seed their microbiome, which helps them protect against disease and all this. Also, the smell of the amniotic fluid, which is on them.
It's disgusting.
Well, yeah, but it smells like breast milk. So it helps a baby latch on. If you leave it on and they smell.
Okay, what I want to know is how do they know this? Because since the birth of babies, everybody's cleaning that shit off immediately.
Well, in like modern day hair. Yeah. Huh? They've done studies like of not cleaning them and cleaning them. I think it was, I can't remember if it was Mayo or Cleveland Clinic. The nurses in the labor and delivery room did a study. Okay. They were like, there's something happening here with people who are like, no, don't wash them right away. And people that didn't. And they did a study of like 1,000 babies in all of this. They were more stable. Okay. They didn't drop their blood sugar. Like it really, I'll
give you this one.
It did help. So it used to be, they'd clean them within 2 hours. And now they encourage you to wait like a day. But they are, I forget, there was like a little catchphrase with the 8 hours. They are like, everywhere is adopting this. Don't bathe them for at least 8 hours.
I'll get that, but can we clean a little bit off?
I mean, maybe their eyes, mouth, so you can give them a little kiss.
Clean the shit off of them.
But anyways, that's delayed birthing. Mm-hmm. That does seem, I
will give you that one.
That does seem that it is very
right. If it's helpful for the baby. Right, I'll give you that one.
I do think it does seem very beneficial to delay the bath for at least 8 hours, which is now the recommended practice.
Well, I'm talking about water birthing.
Okay.
Water birthing. I got my information from healthychildren.org. A water birth is giving birth while soaking in a tub of warm water in your own afterbirth.
My first high school boyfriend was born in a tub.
I can't. I just can't.
I couldn't get over that.
You're all out there for everybody to see. And no. Home water births can be planned with help of a midwife. Mm-hmm. We should cover an episode 2 of just all the different types of nurses there are.
Yeah, we should.
Water births appear to improve comfort in the early first stage of labor, but not beyond that.
Oh.
There is no benefit of water birthing to the newborn. In fact, there could be bacteria in the water that could be harmful to the newborn.
There's 100% going to be bacteria in that water.
Can be serious because now the kid, I assuming they're not breathing in it, but you just, that's literally all it says about water bathing, but it's basically like people aren't doing it anymore because there is a huge risk of that baby getting infected because water is it's made for infection. You're in a warm bath. Bacteria loves warm water.
Yep.
And now you get all this shit stuff in there that's going to breed more stuff. And some mothers have infections. That's all coming out in that water that baby is now in. It's not a way to go. So that was
they do them in the hospital too.
I know.
You can have them.
You
in the
can go to a
hospital.
birthing center.
Yeah.
And they, like I told you, my girlfriend, I think at Beverly Hospital, they had a birthing center and she had this, and she went on and on and on. I mean, she also knits all her own clothes, grows all her own food, you know what I mean?
Well, she's very natural.
She's sweet. She's very sweet. But she had a water birth and we had children 3 weeks apart. Garrett, I sneezed. He was out done, tubes tied, done. I was like heavy spig and shit. She's like, oh, it was just glorious. And he just floated out of me. Blah, blah, blah. I'm like nope.
My thing with that is like I said, I don't like baths to begin with because I'm sitting in my own filth. Now I'm really sitting in my filth.
Well, if I put rose petals in it, would
no,
that okay.
That would definitely not help me. And then, like now I'm really sitting in my filth. Also, I have a thing with being naked in front of people.
Exactly.
And I'm like, I'm not sitting there naked.
And it's my pregnant naked body, which is all
Worse.
just all over the
Which
place.
I know it's beautiful and everybody loves.
It's not my
It's
thing.
fine. I can't do that. I can't do it on a good day. Right. Never mind when I'm pushing shit out of me. Like I just
this is all me. All right, I'm not
That's what I'm
criticizing
saying.
anybody.
This is me.
I don't like pregnant bellies. They gross me out. The belly button looks weird. They're taut. They're veiny. I didn't want to look at myself in the mirror. I sure as hell don't want to look at anybody else's either. All right, I know as a nurse that's a bizarre thing to say, but they gross me out because, like I said, I mean, everything on you is veiny and translucent.
It's weird.
It's gross.
And I know it's me. I don't like it about me.
I'm not criticizing anybody.
I don't want to do that when I didn't want to do that at 20 when
Things you're never going to see
mind.
me do is birth in a tub. You're not going to see me have everybody and my grandmother in there watching my cooch get to an open. I don't want my mother-in-law in there, father-in-law. I mean, no, it was me and my husband. That was it. We're done.
Yeah.
I don't need anybody else in here. Thank you very much.
No.
Go ahead.
Anyways. Okay. See, the decision, I can't tell which is worse. All right. I'm going to do vaginal seeding since we talked about seeding with the
I think that's a great idea.
Cleaner. So I got this information from Cleveland Clinic. Vaginal seeding is the practice of wiping a baby's mouth, face, and skin with its mother's vaginal fluids after a C-section. It transfers vaginal microbes to the baby to help establish the baby's microbiome to promote good health and fight disease. C-section babies are more likely to develop allergies, asthma, celiac disease, and IBS than babies that are born vaginally, which me and my sister are both C-section babies. And
none of you have any of that.
Oh, no.
You
we have all of that. I have allergies,
celiac?
asthma. Stacy has gluten. Like we have, I'm like, this does seem to make a little bit of sense. We seem to have a lot of these immuno. I definitely have 3 of them.
So you think you wanted your mother's vaginal secretion?
No, I don't want her
face?
vaginal, but I do think, it's studied. C-section babies have these more, like the immunocompromised problems. Many think it's because they don't get the mother's vaginal microbes to help establish immune system. That has not been proven, but C-section babies are more likely to get these other.
It could be the trauma of the birth for them. It's you're being ripped out of the abdomen.
Right. I don't know what it is, but it is more likely to happen. About an hour before C-section, the doctor will place a gauze in the mother's vagina, and that will soak up the fluids that are in the mother's vagina. They then place that into a sterile container, like a specimen cup or something, and that sits there and waits for you to have your C-section. It's in a sterile container.
I know my action is ridiculous because baby comes out through your vagina. I know that, but this just sounds disgusting to me.
So then, they do your C-section, and right after delivery, the doctor then swabs the baby's mouth, face, and entire body with that gauze that has soaked up your vaginal.
I could see the body.
fluids.
I don't want them doing his mouth and his nose.
Which again, they do come through your vaginal canal in a vaginal birth, but it's just a weird,
it's weird.
I'm purposely doing it. Do you need to do this? No. Newborns, when they're born through a C-section, get the mother's microbes from breastfeeding. They get it from skin to skin contact. They can get your
shit
stuff other ways. There are risks. Not all the microbes in a mother's vagina are good. Especially usually we are tested for this, but if you're at home, you might not be tested for this. Chlamydia, genital herpes, gonorrhea, group B strep.
It might be the exact reason she's having a C-section.
Right. So if you have these, you do a lot of times have a C-section, so the child isn't going through the vaginal canal. So if that was the case, I would think they would know not to swab this. If you are doing this at home,
you don't know, you had no prenatal care, or
I don't know. So you just, you didn't have prenatal care, you didn't have testing. You just want to make sure you're testing for this because you do not want to swab that on your baby. There are no studies that say that this vaginal seeding is necessary, that it is helpful, that it does any of this.
It's
and
just what people are doing.
The American College of Obstetricians does not support this.
Okay. Well, I was gagging on this one. Placentophagy.
I should have done this one first. Go ahead.
Placentophagy. This is the practice of eating your own placenta.
I just can't.
Literally,
fathom.
I was gagging.
Yeah.
Okay. It can be consumed raw.
Ugh! Why would you eat anything? What's in sushi? They put it on rice
with a little tabook at the top, little green leaves. Here's some wasabi to go with it.
Why would you eat?
Imagine how chewy that is.
Oh, it's like all vascular. Like, why?
And the thing is, if you've ever seen a placenta,
oh my God, it's disgusting.
After 9 months, that fucker is rank.
It's ripe.
It's gross. It's dirty. It's filtered all that kid's feces.
Everything. It's like eating your
gross.
spleen. Why?
And there's a mother, like a cow in her cud.
Oh my God.
Chewing on that old big piece of raw placenta.
I can't eat raw salmon. Never mind placenta.
So it can be eaten raw. You can cook that up with some liver and onions. Or you
that
can
would be better than raw.
powder it in a capsule. Ugh. It is considered a way to reduce postpartum depression. Well, that's what Prozac's for. Boost milk production and or replenish your nutrients. If you have to eat your placenta to replenish your nutrients, you're in bad way.
Yeah.
Okay.
This is not
Let me
good.
tell you this. Not the McDonald's can't replenish for me. Okay. There is no scientific proof of this helping in any way.
The placenta is dead when you're doing this. There is no
dead
nutrients.
and it's dirty. And you don't know what infection is in there yet. I.e., my next point.
Okay.
Because you have a risk of food poisoning because
You
you're
would think-
eating.
You think you're eating a raw thing that came out of your
because
body?
sometimes it starts to spoil.
It's dead. Of course it's spoiled. Are you eating it the second you deliver it? Because it's detached.
I don't know.
There's no supply.
If it's going to get spoiled. 2 separate babies got strep B infections from the mother eating the placenta, and it came out through her breast milk.
See, she wasn't tested for strep B.
Right.
They always
That's a
test.
huge
If you're
one.
in the hospital, they're
Right.
testing you pre having the baby to see if you
Right.
have strep B because those babies
That's
can,
huge.
Yeah.
So 2 babies got it through the breast milk after
God.
the mother had eaten the placenta that was infected with strep B. So there is no beneficial health to eating your own rotting, dirty placenta. It's like going into your house and taking the air filter from you and just
licking it.
scooping it
Ugh.
and licking it. There's no reason to eat the fucking placenta. I was like, this is
I
gross.
just can't.
If you're getting over a
seen
GI
a
bug,
placenta-
not a good. It's disgusting.
They're gross looking.
And you can tell, like, especially some of these kids who've been stressed, you're doing an emergency C-section, that placenta comes out. It's black sometimes.
Yeah.
Like, it's in a or they're old, the kids who've been in for like 2 weeks too long.
Yeah, too long.
It looks
The
rough.
shit's already dying.
Yeah, it's bad. It's bad.
Okay, well, to piggyback on that,
What are we eating next, Laura?
we're not eating, but we might as well be. It's a lotus birth.
Oh,
I got this from healthline.com. A lotus birth is the practice of birthing the baby and placenta and leaving the two attached until the cord falls off, which can be anywhere from 3 to 10 days.
So am I carrying this around like a fanny pack?
Yep. Oh, I'll tell you.
How is that good for the baby?
Oh,
Because okay. I'm gonna stop
normally
asking questions.
the
Just
baby's
listen.
born, right? And it is now the practice to do a delayed cord clamping, so they wait like 3 to 5 minutes, I
So
think. now.
whatever's in there gets back in.
Yeah, because there's blood
Yeah.
going from the baby to the placenta to the
Right.
baby. So they give it a few minutes now. And they used to clamp it like right away. Now they give it a couple minutes. Unless it's an emergency. They got to get it off of it, whatever. So it's clipped now anywhere from 60 seconds to 3 minutes later to get all the blood out of the placenta into the baby, which helps their hematocrit.
Yeah,
it helps
would
give
help
them
everything.
all the blood
Yeah.
they can have and whatever. So we clamp it, cuts off the circulation from the baby to the placenta, and then you cut the cord to detach the placenta from the cord from the baby.
Right.
In utero, the placenta receives the blood and nutrients from the mother, passes it to the baby. It filters everything. It is a vital role.
Yeah,
if
you
you have
can't live without
placenta,
it.
right, that baby cannot survive without the placenta. Vital role in utero. Once a child's born and the placenta is delivered, it no longer has a blood supply because it has detached from
its
that
blood
uterus.
supply, it is now a scab.
It has nothing.
Yep.
It is now dead.
Yep.
So the placenta is dead once you deliver that baby. It's dead tissue.
Yeah.
Dead
It's
tissue.
necrosing tissue.
Yep. Dead tissue, as we know, leads to infection. Leads to
Because
sepsis.
it's warm and wet.
Yeah. It's never good. If you have dead tissue,
You've got to get rid of it.
you have to get rid of dead tissue. So that's why we cut the cord, so the baby's not attached to dead tissue. However, the natural birth world believes lotus births, some people in the natural birth world believes lotus births are more gentle. It can decrease infections because there's no cord trauma.
Oh, come on.
And it is a spiritual practice that honors the relationship between the baby and the placenta. There is, you should see your face. There is absolutely no research that backs these beliefs.
The baby's relationship with the placenta. Laura, did you have a good relationship with your placenta?
I vividly remember my relationship with
Mine
my
was
placenta.
very attractive, very nice, very soothing.
Yeah. If you choose a lotus birth, you will probably be
In the ICU
having a
within
home
a week.
birth. Yeah. With a practitioner that does these. They're not going to do this in a hospital.
No.
They are not going to.
How are you carrying this thing around?
This is a hard no. Oh, I'll tell you. And if you do decide I'm going to do this in my home birth, you need to talk to your practitioner that they've done this before.
Right.
Because there is a specific way that they have to do this. They have to know how to prevent infection. There's like a very specific way.
This is gross.
You need to talk to this practitioner to make sure they know
This
what
is
is
the
happening.
kind of daughter-in-law I'm going to get. You know that, right?
Oh, God, help me, please. Things to consider if having a lotus birth. You can still hold your baby immediately, even though it's still attached to the placenta.
Let me just throw this on my shoulder. Hold on a second.
But you do have to be careful that the cord isn't accidentally ripped out of the baby, because the baby can then, hemorrhage.
Yes.
Yeah. The placenta is usually birthed 5 to 30 minutes after the baby. So the baby will be attached to your vag
For 5 to 10 minutes.
30. It can be up
yeah.
to 30 minutes for that placenta to come out. So you have to realize, like, that baby's still going to be attached to
tethered.
something, tethered to you. So you need to consider that. You need a sterile receptacle to carry the placenta around in. Some people have like this little bag with handles. So you need something, because you can't just pick it up with your hands and carry this
slip
dead
it around. I'm going to throw it on my
tissue.
head. Yeah. Use it as a scarf.
Yeah. The baby still has to ride in a car seat.
With this placenta with it.
Well, the baby, if you're putting a baby in a car, it has to be in a car. You can't hold it because it has a
Well,
placenta.
I wouldn't leave the house. If I'm going to do something this ridiculous, I'm not leaving the house until the
Right,
thing
but
falls.
if you have to bring the baby to the doctor's because now it's attached to a dead.
This is the kid who's getting breastfed till high school.
Yeah. So just make sure that you can safely put your baby in the car seat with the placenta somewhere.
Get a car seat for the placenta.
Yeah. The placenta slowly dries out and decays, which has a smell because it's decaying tissue that's just stagnant
That
blood in a
is
bag, really.
Nasty.
Just stagnant. You know how stagnant
Oh,
blood
yeah.
smells. We know
Yeah.
that smell.
Yep.
And then
Yep.
it's just, you're just carrying that around with you in
With
a
your
dead,
brand new baby.
dying corpse.
How's that relationship now?
It's awful. Some people, you might want to take this into consideration,
They eat it
rub
later?
salt and herbs on the placenta as it dries out, I think, to help the smell of the decay.
As if there isn't enough to do when you've had a child.
The placenta does not nourish your baby after they are delivered, and they still need to be fed every 2 to 3 hours. People think, oh, this placenta has...
They do not think they don't have to feed their baby because the placenta's still attached.
This
Please.
placenta has nourished my baby for 9.5 months inside of me. Well, that is dead now.
Yeah,
You
it
were
has died.
nourishing
Now
your
it's
baby.
out of the human body.
Not the placenta itself was not nourishing your baby.
Right.
You were through
the placenta, like a
Now,
doorway.
It's not attached to you anymore, so it no longer nourishes
Yeah.
your baby at all. Please make sure you feed the baby. baby clothing, you're gonna have to consider that because it needs to have snap closures, not zippers. Not you can't. So you need to make sure you can leave a
How'd you get the
hole
Franks over the beans?
for the cord to reach to the placenta. And you can only sponge
Baby.
bath your baby because
Well, they're not bathing for 2 weeks because of the
vernix. They want the
shit on
vernix.
them, yeah.
But if you do need to bathe your baby, you cannot put them in a bath because they are still attached to this dying, dead placenta.
Disgusting, Laura. On
That's just things to consider if you want to
many
Lotus
levels.
birth.
That is disgusting.
It's why would you leave? I wouldn't leave if my child had a dead hand.
I wouldn't leave it in a
I
bag
wouldn't
for him.
leave it on him because that's going to make him sick. So
But could you imagine going to visit somebody not knowing this and being like, "Oh, look at the what is that smell?"
you would know the smell
I
when
think-
you walked in.
Yeah. Oh no, here's his placenta. Take that with him.
Yeah.
Oh. I'm going to get a daughter-in-law like this.
Well,
I'm going to get a daughter-in-law like this. Well, so when you're going out for your amorous evening on Valentine's Day,
just consider all of these.
you're rolling around on those rose petals that are getting stuck to your sweat.
I'd have a rash. I'm allergic to them. I would be like,
Of course you're allergic to
I would
roses.
be in
of
like
course you are.
anaphylactic shock.
You
by
could
the
get
end
fake
of this.
ones, Laura. Okay.
Okay.
Remember, 9 months later could have its consequences.
Yeah.
So you might want to buckle up and cover up.
Yeah.
Enjoy your Valentine's Day.
Valentine's Day.
Go have some placenta sushi.
Oh my god, it's dead tissue.
But you know it's like I can feel the texture in my mouth. Chewy, slimy.
Oh, it's gonna be the chewiest.
no, thick.
It just has dead old blood in it.
Yep,
What are
blood
you eating?
and urine. The kid's urine was filtered through it. The feces, like it's
It's just a bag of dead tissue.
it's disgusting. Mhm.
Why are you eating dead tissue?
Well, you know what, Laura? When I get my appendix out, I'm going to eat that too.
Yeah, please.
Okay.
My God.
So enjoy your Valentine's Day on that note, and we will see you in 2 weeks.
Let us know if you've eaten your placenta. Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.